Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats. Today we are going to talk about things we don't do and that we are super glad that other people do.
And we want you to do.
Yes. Some of the important specialists that need to be in your life on a regular basis. In primary care, we will frequently have people call us and say, oh, I have a toothache. And I'm like, you know what? I went to school for a really long time and all I did was memorize how many teeth you have and what they're called. Outside of that, not my area of expertise. Yeah. Or vision issues. And then we're going to throw in dermatology and skin so that people recognize what other doctors they should be seeing
regularly.
And our annual wellness visits, I normally will say, here's the part where I drum up business for all my friends. When was the last time you saw your dentist, your eye doctor, your dermatologist? So let's talk about who should be seeing these doctors, the frequency that you should be seeing, why you should be seeing them. Of course, we know if we wake up and our vision's blurry, then we got to go see an eye doctor. But you don't want to wait until your vision is blurry, and we need to be checking in on these things.
Yeah. I had my kids I have poor vision. I wear contacts and glasses. My husband does as well. And so I had my kids start to get seen early, just preemptively. But sometimes kids will get headaches, in school, and then they can't see the board. And that honestly was kind of one of my things was I couldn't see the math board. So I knew something was off, and neither one of my parents have bad vision. And so I started wearing contacts and glasses at age 10. Yeah. But if your kids are not getting routinely screened once a year, we do a vision check like the Snellen eye chart with the big E. And so that is something, if your child's getting their annual wellness exam, we're doing that every year. You
can at least see, hey, they're losing some vision far away.
Yes.
Or if you see them squinting when they're trying to read or things of that sort, then you want to get the eye doctors involved sooner. But from a pediatric perspective,
well, anything that would be abnormal. So if you have kids that, like, if you're like, oh, their eye looks like they have a lazy eye, or that always needs to be, and your pediatrician should be looking at that, noticing that, and referring you on to ophthalmology, if that's the thing. But as far as like a routine screening, we're doing that at annual physicals. And if there is, if you have one eye that's off, I'll have kids, I'm like, hey, they need to go see an eye doctor.
Yeah, I'd have a low index if they're complaining about things being blurry, or if you have a family history of vision issues, you may just preemptively establish with an eye doctor and see them every couple years if you're not noticing some difference.
Well, and now kids are looking at screens a lot, so that blue light, and so protecting their eyes from that. We were laughing because my niece, she wore blue light glasses for months just because she liked them. Like, she wasn't looking at a screen. She just thought they were cute. It was such a fashion statement. But at least she was wearing them because when she was looking at the tablet, she was protecting her eyes. It can help protect
your vision.
But having routine screens for kids.
Yeah.
Is not
and
a bad
so
thing.
if you're like my family, my son one day is just really upset. And where he always gets in trouble if he's not running on time. My husband is all about being on time. And he was looking at the clock and he thought he had time and he just simply couldn't see the clock. Yeah. And so then he got all upset because he didn't have time. And then he was like, I can't see. And I was like, oh my goodness. And so we not proactively, but reactively get to the eye doctor. Yeah. And he ended up getting glasses before he started 6th grade. And so now we want to make sure, if your kids are in glasses or contacts or things of that sort, you want to make sure you're getting their vision checked annually.
Yes.
And then when we get out of the pediatric time span, college kids, 20-year-olds.
So it's every 3 to 5 years for 20 to 40.
Yeah.
And then at 40, which I haven't had this yet, I'm past 40, but the You need the readers.
I'm just going to tell you, there's a day for those of you who are in your 40s, be prepared. There's a day you go to sleep and you can read. And then the next day you can't see anything close up. And I remember looking at a prescription, one of our patients' prescription bottles. Like, when did they start printing so small on these prescription bottles? And then came the readers. And then came, now I've got the whole progressive lenses. And because of how my eyes are, I can't do contacts. So I'm back in glasses. I'd had LASIK surgery when I was young and did well without glasses, but now I'm back in glasses. So there is like when you are pre-40, you don't have to see the eye doctor
40,
as much.
40 to 55 is every 2 to 4 years. 55 to 64 is 1 to 3 years, and over 65 is 1 to 2 years. So the older you get, the more often you need to see.
And I would really say that as we're pushing over 55, consider annually.
Especially, I mean, if you are in glasses and contacts, like I always know when I'm due for my exam because I'm running out of contacts. Yeah. And like I wear my contacts every day. And
which is helpful that you have this, I must, because
I must go. And of course, like, and as they should not refill my prescription without me being seen.
Right.
So going and having it checked, because my vision has changed throughout the years. Like, it's definitely gotten worse. And so my prescription has changed.
Yeah. And we're also looking for a lot of different things outside of just
vision.
Can you see? How's your vision? As we age, we want to catch things like glaucomas and macular degeneration earlier. There are things we can do to help prevent that.
And if you have a family history of that, that definitely increases your risk. Diabetics need eye exams. I mean, we talk about it to our diabetics all the time. Like, I need you to have a retinal eye exam, which is different than a vision exam.
Yeah, so a diabetic needs to see. I don't care how old you are. If you are diabetic, you need to be seeing your eye doctor annually.
Yeah.
The eye doctor may say it needs to be more than that, but you need to at least make sure you're going annually. Diabetic eye exams are very important for catching early diabetic eye disease, diabetic retinopathy, which can cause blindness. And so we really want to make sure that we're staying on top of things for diabetics.
Some autoimmune diseases can cause issues with vision, and then the use of steroids can cause other complications. And so just making sure if you've been on steroids or if you have autoimmune disease, to make sure that you're also seeing your eye doctor.
Uncontrolled hypertension can cause issues, very small blood vessels in your eye. Imagine you have more pressure in these tiny vessels. They can pop. There can be bleeds. There can be other issues. So if you have high blood pressure, I would also encourage you to make sure you're getting annual eye exams to err on the side of caution. Make sure you're staying ahead of things.
Yeah. And as far as eye exams, if you've never had one before, they're really not horrible. Like, you go in and look at a chart. Now, my eye doctor, who's retiring this year, which I'm very sad about, but he always tells me to stop talking because he's trying to look at my eye, and as I'm talking, my face is in the thing, and my, it's moving. He's like, Amber, stop talking. I'm like, oh, okay. It's just a light. You're looking at essentially a Snellen chart.
Yeah. Better with A or better with B?
And then I'm like, I have no idea. But it's not super invasive. It's not horrible. I'm in and out there within 20 minutes.
At a time. Yeah. And when you really look at, people tend to play the would you rather game of, would you rather lose your hearing or lose your vision? Would you rather, no one would rather lose their vision.
Yeah.
No one, it is so much of our sensory input. So protect it. If you take that stuff for granted, you may lose it. So make sure you're seeing your eye doctor.
Well, and you said also like protect it. So things like make sure you're wearing sunglasses matter.
Yeah, the UV is hard on your eyes like it is hard on your skin. So when you are out in the bright sun, it's not bothering me. It may be bothering your vision.
Yeah. And then other things that help protect your eyes are what we've said a million times, like diet, exercise, don't smoke. Those are pretty much the main ones.
Yeah, the nutrients that your eyes need. There are specific vitamins that are important for your vision. When I turned 40, I switched from just a usual multivitamin to the pure encapsulated women's multivitamin. It's called Women's Nutrients. But over 40, the men's nutrients and women's nutrients, also part of what's different in them is that it has all those extra vitamins for your vision to help protect your vision as you age. And so I think that's important too, to make sure nutritionally and exercise. How does it help your eyes? It helps your blood flow. It gets oxygen and nutrients. And so all the stuff that you hear us say to do for all the reasons, and that our specialists come on and say, exercise and eat right, also will help your vision. So your ophthalmologist will tell you that as well. But making sure you get the right nutrients, the right vitamins in is really important.
And then teeth. seeing your dentist.
Yes. And
people love to hate the dentist. I don't mind the dentist. Do you like the dentist? I mean, I don't really care.
you know what? I think that I did not like the dentist growing up. I have a really easy gag reflex, and when they would give me that fluoride treatment, it would often make me sick. I threw up on my dentist once growing up, and I'm sure that was more traumatic for him than me. But so I feel I kind of was like, I don't like the dentist, but now I have a great dentist. I have no problems. My dental hygienist is wonderful, and we see so much chronic disease from poor oral health.
Yes. Well,
and
that's
so
a
you
huge
don't want to
indicator for
wait.
heart.
Yes, you don't want to wait until things go really south, because they're not just going south for your teeth.
Yeah, and it's also expensive.
Yes, you get all of the bacteria in your mouth. It gets to your heart.
Yeah.
It gets to your GI tract, and you get H. pylori and other ulcers. And so,
I mean, you're saying horrible. You're naming horrible diseases, and I'm like, it's really expensive when you have to fix your mouth. Actually,
and it's really expensive to get those horrible diseases too.
I know,
So
yes.
it's a double whammy.
It's a double whammy.
So dental cleaning should happen every 6 months at whatever age. You want to make sure that you're getting those cleanings in.
And if you have chronic diseases like diabetes and autoimmune disease that we mentioned for your eyes, you may need to see the dentist more frequently.
Yeah. But a relationship with a dentist that you trust is so crucial. Making sure you get the dental issues taken care of as they arise.
Yeah.
People will push that off because it's expensive, and then it will get more expensive because it creates downstream negative consequences.
I often will get asked, when should my child see the dentist? What age should they go?
Start?
So I have always said, and this is kind of with the American Dental Association, is when you see the first tooth eruption, which is actually very young. But I feel like that also just helps establish for them to see a dentist they know and that they're not scared of.
Yes.
And I mean, when my kids now they go to a bigger person dentist, but and honestly, our insurance covers it, and that's why we switched, is because our dental insurance stopped covering who we were seeing. But like have you ever been in a pediatric dentist office?
Oh yes.
I mean, these are the most beautiful places,
and you get so many toys.
And there's like there was TVs and like the floor. You would walk and it looked like water on the floor. I'm like, this is where I want to come to the dentist.
Oh yeah, and you can't. They call the kids, but the kids don't want to leave the lobby because they're gaming and playing and
like
play
they make it so fun. So just to establish good healthy habits. So like making sure.
And I think when you do start younger like that, it also helps them to learn how to care for their teeth and to prioritize caring for their teeth.
Yes.
You don't want to start brushing too late, because then you end up with a lot of issues right off the bat. Then the kids get a little traumatized because they're having to get their teeth drilled early. So when you go early, they start realizing, oh, it's important to brush.
Like brushing your teeth, important to floss.
Yeah.
And we're both, which I'm out. I've just finished. We're done with braces, but you're just starting braces.
Just got braces on my son a couple of weeks back.
And so finding out like early detection of things for kids, like overbites, underbites.
Yeah.
My son had to have oral surgery. Sometimes too with kids, like reflux will cause erosion on their teeth, as will with adults. And so sometimes dentists actually help diagnose disease.
They do. Yeah. They can put a light onto things by what they're seeing in people's mouths.
Yeah.
And yes, so making sure that you have the eye doctors, and the eye doctor can be a little harder because you can go years before you need it. So kind of making sure you keep track. I went to my eye doctor once. I was like, it's been a couple years since I've been here. And he's like, Shelly, it's been 5. And I was like, oh, because I'm supposed to come every year. So I think I'm a little bit late. So making sure you stay on top of that stuff better than I do. But the dentist, it really should be every 6 months. And you want to make sure that you have good oral health, because that
smokers
will be a downstream.
Well, quit your smoking. I mean,
Yes.
I say that with all the tenderness that I can muster up.
Yes.
But that if you're a smoker, you definitely need a good dentist.
Yeah.
Good oral hygiene.
Other important things to remember: coffee, wine, other things that stain your teeth and have high acidic. If you have things in your diet that are pretty acidic, it could be orange juice, tomato sauces, things of that sort that can have an effect on your teeth. If you're on certain prescriptions will affect your oral health. Like a lot of prescriptions will make people have dry mouth, and saliva is important for a healthy oral environment. And so if you suffer from dry mouth, you may end up with more dental issues. Maybe worth having a conversation back with your primary care if you're having a lot of dental issues about what prescriptions you're on and whether they could be contributing to some of those problems. There are osteoporosis medicines that you want to make sure that you're having your teeth regularly checked, because it can cause some bone erosions in your teeth and in your mouth. So depending on what is going on with you, otherwise you may need more frequent dental visits.
Yeah. And then dermatology, like we're huge advocates on getting an annual skin check at least one, obviously annual means once a year. So.
And look, you know who you are. If you have been over sun exposed, whether it was intentionally because you are my age and we would lay outside with baby oil, not sunscreen when we were growing up. If you have had
the glow is different than the glow we want these days.
That's right. That if you have had multiple sunburns in your life, so and it wasn't multiple sunburns in a year or at a summer camp, it's collectively through your life. If you've had sunburns 2 or 3 times, you have greatly increased your risk of skin cancers. Any moles that change over time can be problematic.
Well, people who work outside, athletes,
yes,
like multiple. You have lots of sun.
And we will tell people, hey, you need a colonoscopy because we need to look at the inside of your colon to make sure there are no cancers growing there. And that is across the board. We say that to everyone, whether you're at higher risk or not. Well, it's the same thing with your skin. You need to look at your skin to see if you have any
and they have
risks.
Those fancy little microscopes,
all the magnifiers, and they know exactly what they're looking at as normal, not normal.
I'll tell a patient, they're like, what do you think about this? I'm like, oh, definitely go have that checked. And then that spot was fine, and they found something else because they were there.
Yes.
And it ended up being like a melanoma or a basal cell, something that needed to be removed. And so I'm like, well, I'm so thankful that you asked me about that one mole that didn't matter at all.
Yes.
Because then they found the other one that did.
And unfortunately, in a primary care setting, some primary cares do, and I think it's fabulous if they can. We schedule our annual wellness visits for a half an hour. That is what insurance will allow for us to check all of the necessary boxes. We're asking you questions to see if you may have depression hiding. We're trying to do as much head to toe physical as we can. We're trying to check all the preventive boxes. Did you have your colonoscopy? Have you had your mammogram? Do you need these vaccines? All the stuff. I cannot strip you down and look at your entire skin during that same visit. So I will frequently in that visit tell people I recommend that you have an annual dermatology visit. And at what age should you start that? Well, the older you are, the more sun exposure you've had. And so I don't know that I am not aware of a specific recommendation to start seeing the dermatologist, but I would say evaluate your risk factors. If you're a person who works outside and you have a lot of sun exposure, if you were
tanning bed when we were in high school getting ready for prom. I have a friend that had a melanoma on her face at 22, 23, really young. So you can't, I don't know that age is necessarily an indicator.
I don't think so either. It's really about your amount of sun exposure, your family history. Please know that melanoma is a genetic cancer. And so if anyone in your family had melanoma, then I recommend you have a dermatologist and a check every year, no matter what age you are, because you're at increased risk. If you have anything you notice that has changed, but if you're a person with a lot of freckles and moles, I think you're a person who should see dermatology every year. Yeah. Just like when we catch a early polyp in a colonoscopy and we remove it, it never becomes colon cancer. Yeah. When we can get those basal cell, squamous cell, and melanomas caught early, then we just remove it. If it's a stage 0, then that means we could take that melanoma, which could be a metastatic cancer, just by getting rid of that little part of the skin. But if we don't catch it early, then it can start spreading and it can certainly be a terminal disease. Yeah. And so I think making sure that you are really on top of your skin checks is important too. And I would recommend really for anyone, especially anyone over 18, to make sure that they're getting
I do it every year. I actually do all of my stuff. I take a day off of work and I go and do all my annual screenings at all of my
in one day. You can get all of this stuff in one day. See your dentist, see your eye doctor, see a dermatologist, get your annual wellness. And then one day prevented you from having weeks and months of different things when things go wrong.
So these are the things we want you to do that we don't necessarily do here at our clinic, or your primary care wouldn't do, but we want you to do them. So it's
one
important.
Doctor is not enough, people. One primary care is not going to be able to take care of all the stuff. Yeah. You need a dentist. you need an optometrist or ophthalmologist. And let's just talk through quickly
about the difference.
Who needs an optometrist and who needs an ophthalmologist, and why you would need either. An optometrist went to optometry school, an ophthalmologist went to medical school, and then went on and did residency in ophthalmology. So if you are a person who is really more concerned about disease-related and medical-related eye issues, an ophthalmologist may be more appropriate for you. They overlap in a number of ways. An ophthalmologist can do the easy, you need glasses and contacts. Optometry certainly does a lot of that. Optometry can do a diabetic retinal exam. Our recommendation would be see one.
Yeah.
And if you're at the wrong one, they'll tell you.
Yeah.
Ophthalmology will tend to be all encompassing and do all of the things. Optometry may have points where they refer you on to an ophthalmologist if something is
but
more
even ophthalmology will
disease-related.
refer on to like retinal specialists. Like I don't think people
Exactly.
realize how many, unless you have a problem with your eyes, you don't realize how many
eye specialists there
there
are.
are. Yeah.
Yes. And so you may, if you are a diabetic, hypertensive, lots of chronic diseases, I might lean toward telling you to have an ophthalmologist who's got MD or DO behind their name. But optometry is not wrong at all, and you can certainly start there. And I think getting into either of those, ask your people that you trust, who do you see for your eyes, and start there. And if you're not in the right place, they'll let you know. And same with, dentist, have a dentist. And if you need an oral surgeon or a,
endodontist.
Yeah.
They're all some fancy specialists. And dental work too. I don't think that people realize.
They're gonna send you on to those people as needed. That our story is pretty much the same as it is in so many times when you listen to us. Start early, think prevention, live a healthy lifestyle, and you can keep yourself healthy. But you would much rather have these people on board when nothing's wrong than to have things go wrong.
And then they know you too. Like that's the beauty of a step. Like I'm so sad that my eye doctor is retiring because now that means I have to find a new one. But like he knows me. He knows that I'm going to talk the whole time. He's like, Amber, shut up. And it's not offensive to me.
Right.
Like I love him and I don't care.
Exactly. And then you already have a trusting relationship for when things start.
Something goes wrong.
Yeah, exactly. So have a dentist, have an eye doctor, have a dermatologist. Please find people you trust to do these things. Your primary carers will thank you.
Yes.
Because we'll make sure that we're taking really comprehensive care of everything. Thank you so much for joining us today as we drum up business for all of the people that we care about and appreciate so much in making sure you see the appropriate specialist. We like to leave you on a good note. So here's today's Tell Me Something Good. Coworkers. I think that coworkers can be the greatest blessing. They're people who we didn't really choose to be in our life, but that for some reason have been placed there, whether it is to teach us something or support us. I know that I wouldn't know Amber if she wasn't my coworker, and she is a huge, valuable part of my life. So instead of being annoyed by our coworkers and how they might be interrupting us while we're trying to get work done, instead, let's embrace the fact that these people have been put into our lives and they are such a blessing and so many things that they do to support us in hard times. Thank you for joining us today. And until next time, take care of yourself.